Hey everyone, how's your heart doing? Everything good, or have you noticed any strange signs lately? In today's video, I'm going to talk about 7 signs that may show up in your body, indicating that your heart might not be at 100%. Hi, I'm Dr. Marcos, welcome to the You Stronger channel. Before we dive into the details, make sure to hit that subscribe button and give this video a thumbs up. Your support helps this video reach as many people as possible. Can I count on you for that? As we all know, heart disease is the leading cause of death worldwide. The heart is responsible for around 400,000 deaths every year. To help you understand how your heart is doing, we're going to break this video into 3 parts. First, we'll talk about the 7 signs you can look for and notice when something's not right. In other words, what to watch for in your body to see if there might be a heart issue. In the second part, I'll explain the 7 classic symptoms, the ones you actually feel when your heart's not doing well. And in the third part, I'll give you some valuable tips on how to avoid heart problems in the future. So, tell me, do you have any heart problems, or do you think you might? And where are you watching this video from? Let me know in the comments. Let's talk about the 7 signs you should watch out for that could indicate a heart problem. I'm sure that from now on, you'll start paying closer attention to people's ears. Yes, you'll notice this. Why? Because there's a little sign on the ear that might indicate blockages in the heart arteries, the coronary arteries, or even the carotid arteries. Seriously, it's true. Back in the 70s, Dr. Sanders Frank noticed that many of his patients with angina, that chest pain, had a diagonal line on their ear. He called it the Frank sign. But what does the ear have to do with the heart? One theory is that the same factors causing narrowing of the arteries could also create this mark on the ear. But does this mean everyone with Frank's sign has artery blockages? Not exactly. Out of 100 people with this diagonal mark on their ear, 30 might not have anything wrong, it could just be a sign of aging. But 70 might have some kind of problem. And the younger the person, the higher the chance it's a sign of a blockage in the coronary or carotid arteries. For example, if a 40-year-old has Frank's sign, we need to pay more attention than if it's an 80-year-old, who most likely has this mark just because of aging. And the sensitivity of this sign is low, meaning that out of 100 people with artery blockages, only 40 will show this sign. So, don't celebrate if you have smooth ears, okay? 6th sign, hair loss on your legs. Losing hair is a sign that something might not be right in your body. It usually starts on the shins and then moves up to the thighs. This could be a sign of peripheral artery disease, which is a blockage in the arteries of the legs. And since atherosclerosis isn't a localized disease, it tends to spread. So if you have blockages in your legs, there might also be some in other arteries in your body, including the coronary arteries, which supply blood to your heart. Most people with peripheral artery disease only realize something is wrong when the condition is already quite advanced. But why does this hair loss happen? It's because hair follicles need nutrients to grow hair. For that to happen, good circulation is essential. If your arteries are clogged with fatty plaques, blood and oxygen aren't reaching the areas properly. In addition to hair loss on the legs, people might also notice smoother, shinier skin, dryness in the extremities, and slower nail growth. However, keep in mind that hair loss on your legs can happen for other reasons, not just peripheral artery disease. Genetics, for example, can play a role, as well as factors like friction from clothing. 5th sign, xanthelasma. You've probably noticed someone with a yellowish patch on the upper eyelid. That's xanthelasma. It doesn't hurt, and it's usually just an aesthetic issue that grows slowly. Xanthelasma is the most common type of xanthoma, which is cholesterol deposits in the skin. It's more common in women over 45 and usually appears in the inner corner of the eyes, often on the upper eyelid. In about 50% of people who develop xanthelasma, there's a history of high cholesterol or elevated triglycerides. And here's something interesting, only about 1% of people with high cholesterol develop xanthelasma. But researchers have found that having xanthelasma increases the risk of heart disease, heart attack, and stroke. So, if you notice this sign, it's important to get a blood test to check your cholesterol and triglyceride levels to make sure they're not elevated. 4th sign, senile arc or senile halo, as the name suggests, is related to age. This is more common in older patients and is caused by the buildup of cholesterol along the edge of the cornea. The deposit appears white or gray and is visible above or below the outer part of the cornea. In some cases, the halo might even cover the iris, which is the colored part of the eye. People might notice that their once dark golden color is now turning lighter. Senile arc doesn't affect vision and typically doesn't require treatment. But here's the catch: if this halo appears in younger people, before the age of 45, it could indicate severe dyslipidemia, meaning very high cholesterol and triglyceride levels. In these cases, it's associated with an increased risk of heart disease. If you're older and have this arc, don't worry, it's normal. About 60% of people over 60 have this sign, and after 80, 100% of them will show it. So, if you're over 60 and look in the mirror, there's no need to panic. Third sign, cyanosis. This refers to the bluish or purplish color of the skin. If you're feeling cold and your skin turns a bit more purple, that's normal, but this can also be a sign that you have a heart or lung problem. If any part of your skin becomes cyanotic, meaning it turns blue or red, even when you're in normal or warm temperatures, it could indicate that area of your body isn't getting oxygenated blood, the red blood. This could be due to a blocked artery. Now, if the person also complains of shortness of breath, it could point to a lung issue, such as pneumonia, emphysema, or even a pulmonary embolism. Or, in the case of heart stress, when the heart is unable to pump enough oxygenated blood. Of course, other heart conditions, like congenital defects or atherosclerosis, can also cause cyanosis. Second sign, ulcers. Those wounds that won't heal on your legs or feet could be a sign of poor circulation. It could be arterial stress due to blockages in the arteries that supply blood to that area, and normally, the person won't be able to walk quickly. This happens because the legs get tired, painful, and even cramps can occur. Most of the time, these ulcers are painful, but if you have nerve damage, like diabetic neuropathy, you might not feel any pain. Arterial ulcers typically appear on the outer side of the leg and on the heel or toes, and they generally don't bleed. On the other hand, venous ulcers, more common in people with varicose veins or deep vein thrombosis, usually appear on the inner side of the leg and tend to bleed. And the first sign, swelling in the legs, ankles, and feet. This swelling, or edema, in the legs and ankles could be caused by a weak or enlarged heart, which leads to fluid buildup in the body. You might notice that your shoes no longer fit, your sneakers feel tighter, or your ankles get puffy, like bread rising, and if you press on it, you'll see an indentation, the classic horse sign. It's more likely that you'll notice the swelling in your legs and ankles at the end of the day, because gravity increases the pressure in the veins of your legs. However, if you lie down and elevate your legs, this can reduce the swelling. Now, what are the 7 symptoms you might experience that could indicate a heart problem? The first symptom you should watch out for is shortness of breath or dyspnea, especially when you exert yourself. It's disproportionate fatigue for the efforts you're making. You start to feel more winded with everything you do. This could be a heart issue. Second symptom, persistent cough with white or pink sputum, which indicates that there's fluid in your lungs or alveoli. It's important not to ignore this cough. Seek medical attention. Third symptom, shortness of breath when lying down. The person starts to use more pillows to try to sleep better, and over time, they can no longer lie down at all. They need to sleep in a chair. They may even wake up feeling suffocated during the night, which is known as paroxysmal nocturnal dyspnea. This is a key indicator of heart problems. Fourth symptom, general weakness, a constant feeling of fatigue, and difficulty performing daily activities such as shopping, climbing stairs, carrying things, walking, or even combing your hair. This happens because the heart is unable to pump enough blood to meet the needs of the muscles and tissues in the body. Fifth symptom, nocturia. When you go to bed, you need to wake up several times during the night to urinate. This happens because the heart is not pumping blood adequately to meet the body's needs. Nocturia has several causes, but when the heart isn't functioning properly, excess fluid must be eliminated during the night. Sixth symptom, intermittent claudication. When you walk only a few meters, you feel pain in your calf or leg. It's not a constant pain, but it arises when you exert yourself and improves when you stop. This symptom indicates that blood is not reaching that area as it should. When you stop, the pain subsides, but when you start walking again, it comes back. Seventh symptom, chest pain. If you're feeling chest pain, the first thing you should consider is that it could be a heart problem. Don't jump to conclusions thinking it's a muscle strain, gas, or something simpler. It could be that, but the most important thing is always to rule out the most serious cause first. Cardiac pain is a discomfort or pain in the chest that lasts more than a few minutes. It may come and go and can feel like pressure, tightness, heaviness, or a burning sensation. It may radiate to the left arm, neck, back, jaw, stomach, and even to the elbows. The pain can be accompanied by sweating, pallor, nausea, and dizziness. If you experience these symptoms, you should seek medical help as soon as possible. Now, the question is, how can you prevent and avoid developing heart problems? First of all, exercise. Get out of your chair and don't stay still. Physical activity is essential for blood circulation, heart health, and your overall physical and mental well-being. You don't have to do anything extreme, but walking, cycling, and swimming are great low-impact activities that improve blood flow, especially if you have chronic obstructions in your veins and arteries. Besides improving your physical fitness, these activities increase oxygenation in the body and reduce the risk of heart problems over time. Another important tip: if you smoke, quit immediately. Smoking is one of the worst things you can do for your health. It causes a range of problems, such as impotence, inflammation in the arteries, formation of fat plaques in the veins, and consequently, increases the risk of heart attacks, strokes, and even dementia. Don't wait any longer to take this step. When you quit smoking, you'll start seeing immediate benefits in your cardiovascular health. Also, if you're overweight or obese, it's crucial to lose weight. Excess weight puts strain on your heart and organs, raises your blood pressure, and impairs your blood sugar control. It also increases the risk of blood clots, fat accumulation in the liver, and joint problems. Remember that excess weight is one of your heart's biggest enemies, so adopting a balanced diet and working on losing those extra pounds is an important step in maintaining cardiovascular health. Another golden recommendation is to eat healthily. Consume more fruits, vegetables, whole grains, olive oil, and fiber. These foods not only help maintain a healthy weight but also help lower cholesterol, improve digestion, and keep triglyceride levels in balance. Avoid trans fats and saturated fats as much as possible, as they contribute to the formation of fat plaques in the arteries. A healthy diet is essential for a long life with fewer risks of heart complications. Lastly, if you have a family history of heart problems, such as heart attacks, strokes, stents, or heart surgeries, it's important to be extra cautious. Genetics can play a role in your heart health, so it's essential to have detailed exams. If your cholesterol and triglyceride levels aren't good, talk to your doctor and don't be discouraged if they prescribe medication. Keeping your exams up to date, along with focusing on healthy eating and regular exercise, can make all the difference for your long-term health. Did you know that 80% of cholesterol is produced by the liver? Even if you do everything right, sometimes that's just not enough to control cholesterol levels. It's important to know that keeping your glucose levels under control is just as crucial. If you have diabetes or are pre-diabetic, managing your blood sugar levels correctly helps reduce complications. A good reference for monitoring your glycemic control is the HB glucose index, which shows the average levels over the past 10 weeks. This can give you a clearer picture of your health and how well you're managing it. If you experience any of the signs I've mentioned, don't hesitate to see a doctor. Explain your symptoms and follow their guidance. Taking a proactive approach to your health is essential. It's much easier to prevent issues than to treat them once they've developed. I hope this video was helpful for you. If you think it might help someone else, share it with a friend or family member to spread the knowledge. And don't forget to subscribe to my channel. It helps this content reach more people around the world. Thank you so much for watching.
Legal disclaimer. This video is for educational purposes only, aimed at instructing the public on various topics related to medicine and general health. The information provided in the videos is not intended to replace medical consultations or serve as recommendations for any treatment plans. If you have any questions, please consult your doctor. Medicine is a constantly evolving field, and the videos are based on the most recent scientific articles available at the time of production. The videos are strictly for educational purposes only and do not disclose addresses or phone numbers of any office, clinic, or service.